Okay, let's start on Chapter 6, page 111 in your books. Follow along. All right, so the musculoskeletal system, there's three main functions. It gives the body shape, it protects vital internal organs, and it provides for body movement. The skeleton consists of the skull, spine, ribs and sternum, shoulders, upper extremities, and pelvis and lower extremities. So the skull, that's the bony structure of the head. Its function is to protect the brain, basically, and it's a fixed space inside the skull. There's only enough room for the brain, which is 84% of that space, and then it also has blood, and it has a fluid in it called a cerebral spinal fluid. So the blood and cerebral spinal fluid only take up about 15 to 20% of the skull space. The cranium is the top, back, and sides, and the face is the front of the skull. The skull connects to facial bones. There's mandible, which is the lower jaw, the maxilla, which is the upper jaw. Then you have all of the little nasal bones, and the bones that surround the eyes that our eyeballs sit in are called orbits, and our cheekbones are zygomatic arches. And here's a picture of all of those bones. If you can see down on the mandible is the moving part of the jaw. The maxilla is the upper part. And then all of the other bones that were listed. You see that the skull has some little like cracks in it. These cracks are called sutures, basically, but they're little fissures that kind of divide the various bones of the skull. The very back is the occipital bone, and that's actually true that it is at the back of your brain is where you visualize things, so that eyeball sees stuff, and then you have a nerve that goes from the eyeball to the back of your bone, and it goes to the occiput. That also is, in kids, a very large bone, and they have a much bigger head because their occiput is so much bigger than when they're small. The temporal bone is that side bone of the skull, and then you've got the parietal bone on top, and then the frontal bone, more or less your forehead. The other parts of the musculoskeletal system, let's talk about the spinal column. There are 33 vertebrae. These are essential for movement, sensation, and vital functions. The spinal column are divided into sections, and these sections start with the top bones. There's 7 of them, which are the cervical bones, and then there's the middle bones, which are the thoracic bones, and there's 12 of those. And then you have the lower back bones, which is the lumbar spine, and then the sacral spine, and then of course you have the tailbone. It's very important that you memorize these spinal column bones. Look on page 120, and at the very bottom there you can see where they divide the spinal column into the different sections. The cervical spine, there's 7 of them. The thoracic spine, 1 through 12. Lumbar spine, 1 through 5. And then the sacral, and then the coccyx bones, for a total of 33 vertebrae. A good way to remember this, once you get the divisions of it, cervical, thoracic, lumbar, sacrum, and coccyx, is breakfast at 7, lunch is at 12, and dinner is at 5. 7, 12, 5. And then you have the sacral and coccyx bones. The thorax contains the heart, lungs, and major blood vessels. That's basically our torso. But the bones surrounding it are the ribs, and they're called the thorax, and they protect the heart and all those major blood vessels. And here's a picture, same as on page 120, of your cervical, thoracic, and lumbar, and then sacral and coccyx vertebrae. You notice at the very top there, the atlas and the axis. C1 and 2, those are very critical bones. That's up there where it connects into the brain. And to damage these can actually cause death because it disconnects the spinal column from the brain. That up in there at the base of the brain is where all of our vital functions take place. That's where our blood pressure and our heart rate and our breathing are all controlled. So the pelvis, next part of the musculoskeletal system. The parts of the pelvis, the bony parts, are the ilium, the ischium, the pubis, the hip joint, and connecting into the hip joint is the very top of that leg bone. It's called the acetabulum. It's the round part that actually fits into the pelvis. It's the ball that's at the proximal, and there's that term. Proximal is closer to the torso. Distal is farther away from it. So the proximal end of the femur or the thigh bone is the acetabulum. The lower extremities. In the lower extremities, we have the femur, which is that thigh bone again, the patella, which is the kneecap, the tibia and the fibula are both parts of the lower leg. You have the ankle, which are the lateral side, which is the side that's on the outside of the ankle, and the medial side, the one that faces towards the medial line. So the lateral malleus and the medial malleolus. Our lower extremities. Our foot consists of metatarsals and the calcaneus, which is the heel, and then our phalanges, which are our toe bones. Upper extremities. We've got our clavicle, which gets broken a lot, those of you that have ever had a clavicular fracture. You have the scapula, which is the shoulder blade. The acromion process, or the acromioclavicular joint, is the joint that fits right into the shoulder. It's that round portion that we can move around. And then the humerus is the upper arm, and the radius and ulna are both the lower arms. The radius is on the thumb side. Our upper extremities have wrists, which are made up of carpals, and the hand has metacarpals, and then the phalanges are the finger toe bones, just like the phalanges are toe bones too. So that makes up our skeletal system. Bones that you should become familiar with, study, know where they're at, so that you can understand and describe what types of things you see when you go on an emergency call. The musculoskeletal system also has joints. These are where the bones connect to other bones. There's a couple of types of joints. We've got the ball and socket joint, so one is kind of a round shape that fits into a socket, and those can rotate around in a lot of different directions. Hinge joints can only go one direction, up and down usually. Muscles then. We talked about these in the previous chapter. We have voluntary muscles or skeletal muscle because it generally connects to the skeleton, and they are under our control. We can control those. involuntary muscles work and we don't even realize it. We don't have to think about it or make them work. Cardiac muscle is only found in the heart. A couple of things that are specific about cardiac muscles is that it has automaticity. The heart has the ability to generate and then conduct its own electrical impulses. So, our muscles. We have the skeletal muscle that we can control. We have the cardiac muscle that's in the heart. And we have smooth muscle, usually found in the intestines, and they work on their own involuntarily. Our respiratory system brings in oxygen when we breathe in, and then it also gets rid of carbon dioxide when we breathe out. This is important to know because it's very important to get rid of all the carbon dioxide. If it builds up in our system, then our body becomes acidotic and it can die. So we want to keep all that carbon dioxide as we make it. We want to be sure and take the trash out, so to speak. We also want to make sure we bring in plenty of oxygen. In the atmosphere, there's only 21% oxygen, so we breathe in 21%. We only use about 4% of that because 16% is exhaled when we exhale the carbon dioxide. We also keep a certain amount of carbon dioxide in our body. That gives us the stimulus to breathe. We usually keep about 35 to 45 millimeters of mercury, they call it, that circulates through our system. So air enters our body through the mouth and nose. It moves through the oral pharynx, so the mouth and the back of the throat, and the nasopharynx, which is the nose and the back of the throat. The pharynx is the back of the throat. So oropharynx is the mouth part, nasopharynx is the nose part. Air moves towards the lungs. And the epiglottis is a little leaf-like structure that covers the trachea and covers that glottic opening to the windpipe to keep all of the fluid and food that we eat out of our lungs. The larynx is a voice box containing vocal cords. And it sits in the trachea, inside the trachea actually, right around where the cricoid cartilage forms over the lower portion of the trachea. The trachea is the windpipe. And then we have our lungs, which has passageways in it to get so that the oxygen can travel through and get to the alveoli, which is the grape-like sacs where our oxygen is stored. So alveoli and the bronchi and bronchioles are what take that oxygen to the alveoli. The diaphragm is also a muscle we use in respiration. Its contraction and relaxation helps to move the air into and out of our body. So the respiratory system is made up of all these structures: the lungs, the bronchioles and bronchi, we've got our nose and our mouth, and we've got the windpipe or the trachea. Inhaling is an active process. The diaphragm and the intercostal muscles contract. The diaphragm actually flattens and moves downward, and the ribs move upward and outward, and the negative pressure pulls air into the lungs. Picture a syringe, and pulling the syringe, and air goes into that syringe. Exhalation is a passive process. It's a time when our body and our muscles relax. So the diaphragm and intercostal muscles relax, and then that positive pressure pushes air out of our lungs. Ventilation, then, is the movement of gases to and from alveoli. You have to have an open airway in order for that to happen. So if there's any swelling or closing off or choking or anything blocking the airway, then you won't get that movement of gases to and from the alveoli. And you have to clear that passage before you can go any farther in trying to actually get oxygen into the lungs. The actual respiration process happens down in the alveoli and then also at the cells. It's the exchange of gases between the cells and bloodstream. Oxygenated blood is carried from the lungs to the heart, and then it's pumped to the rest of the body. At the cellular level, oxygen is exchanged with cells for waste carbon dioxide. And then that deoxygenated blood returns to the heart and then to the lungs to exchange waste, the carbon dioxide, for oxygen. So it's just like a constant supply system. Once again, in order to get air in and out of our lungs and to our alveoli, we have to have an airway or an opening for that to happen. You can see that that opening is very small in children. Do you see where that tongue and the back of the throat, there isn't a whole lot of space there? The tongue is just a muscle. So if people go unconscious, that tongue will just relax. And as it relaxes, it'll block that opening. And we need to make sure and keep the tongue off of the back of the throat in order to keep that airway open. That's why we do the head tilt chin lift, or we do a maneuver called the jaw thrust. And we'll practice that in class because maintaining an open airway for our patient is very important. The cardiovascular system, made up of the heart, the blood, and the vessels. There's 4 chambers in the heart. The upper chambers are called the atria, and the lower chambers are the ventricles. But it's actually 2 separate pumps all in one that functions simultaneously. The right side of the heart receives blood from the body and pushes it to the lungs so that it can exchange the carbon dioxide for oxygen. And once it picks up the oxygen, it goes back to the left side of the heart, and it's then pushed by the left side of the heart to the body so that it can give its oxygen to the cells and pick up the carbon dioxide and come back to the right side of the heart. So, as it goes through the heart, the pathway is from the right atrium down to the right ventricle, and then to the lungs, and back to the heart, to the left atrium, to the left ventricle, and then out through the aorta to the body, and then back again to the right side, coming in the right atrium to the right ventricle, out through the pulmonary artery to the lungs, back to the left side of the heart to the left atrium, left ventricle, and then out through the aorta to the body. And here's a good picture of that flow through the heart. See how it comes in? Those vessels it's coming into the right atrium are coming from the body. That's the superior and inferior vena cava. And then number 1 is the right atrium. Go down to the right ventricle and then out to the pulmonary artery, to the lungs, back through the pulmonary vein to the left atrium, which is number 4, down to the left ventricle, and then out through the aorta, the big red vessel which goes to the body. We also have a cardiac conduction system. That's the electrical impulses that keeps our heart beating. They have automaticity, so they generate their own impulse. And that starts in the SA node. The sinoatrial node is called the pacemaker of the heart. If it's functioning correctly, your heart will beat about 60 to 100 times per minute. That impulse generates in the sinoatrial node and then travels down. It goes across through both atriums, so they beat at the same time. Then it goes down to number 2, which is the atrioventricular node. And that's where they it's like a resistor that gathers the impulse, and then it goes down through the center of the septum of the heart, and then it travels around, causing the ventricles to contract and to push out all the blood that's in there to where they need to go. Some important arteries you need to know about. The coronary arteries. The coronary arteries encircle the heart and feed the heart muscle itself oxygen and pick up carbon dioxide from there. The aorta is the largest vessel in the body that delivers oxygen to all the cells, and it comes off of the left ventricle. The pulmonary artery comes from the right ventricle going to the lungs to pick up oxygen. Remember, arteries go away from the heart, veins come back to the heart. The carotid artery, that's the artery in your neck. Very large artery on each side of your neck. You can feel a pulse there. And the femoral artery, down in the groin on either side. Those also are very large arteries. They're coming down off of the aorta where it divides and starts to go down the legs. You also need to know the brachial artery. The brachial artery is the artery where we check for a pulse in infants. It's in the upper arm. The radial artery is on the thumb side of our hand in the wrist. There's also an artery in the posterior tibial behind the ankle, and the dorsalis pedis is on top of the foot. You can check all of these arteries, and that is where you'll find a pulse. The circulation of the blood. As arteries go away from the heart, they become smaller and smaller and turn into arterioles, and then into what we call capillaries. Capillaries are the smallest vessels that actually surround the cells, and that's where the oxygen exchange takes place. Then they begin to connect into venules and then turn into veins headed back to the heart, the right side, to take the carbon dioxide back so it can be exhaled out through our lungs. Blood composition, you should know. Plasma. More than half of the volume of blood is plasma. It's the fluid that the blood circulates in, and that's how it flows and keeps moving. The red blood cells are very important. RBCs, or they're called erythrocytes or red corpuscles. And those are the actual cells that carry oxygen around and deliver it, and also pick up carbon dioxide. White blood cells, WBCs, leukocytes, or white corpuscles. Those help to deal with infection. Platelets help with clotting of the blood. We have to have platelets in order for our blood to clot. The pulse, the pressure of the blood flowing down an artery when the left ventricle contracts. You can feel a pulse anywhere that an artery goes near a bone. Just compress the artery over the bone and you can feel that pulsating. Peripheral pulses are the pulses that are on the outer parts of the body, such as the radial pulse, the brachial pulse, the posterior tibial, or the dorsalis pedis pulse. Central pulses are near the core of the body. You have the carotid and the femoral pulse. Central or core pulses are near the center of the body, and they can be felt even if peripheral pulses are too weak to be felt, because that circulation is closer to the heart, so it's a better indication of whether the heart is still beating or not. That's why when you do CPR on somebody, when you come up on them and they're unconscious, you check for a carotid pulse. You want to feel a pulse closer to the body. The blood pressure is the force that the blood exerts against the walls of the blood vessel. Systolic blood pressure is the upper reading. Arterial pressure, it's the pressure you feel when the ventricle contracts, and that is the heart when it's contracting. The diastolic pressure is the lower reading, and it's the pressure when the heart is relaxing and just filling with blood. So you can remember that diastolic is the heart at rest, and when you're dead, you're resting, and you're put under, so it's the bottom number. Perfusion. If you are perfusing, that means your blood is circulating adequate and exchanging its oxygen and carbon dioxide. Hypoperfusion is low perfusion. That means there's not enough circulation going on when the flow becomes inadequate and then the exchange isn't taking place. This is what we call shock. So the real medical term for shock is called hypoperfusion. So let's think about it. How is the function of the respiratory system related to the function of the circulatory system? They both work together to take oxygen in and distribute it to the cells. So the life chain support is the interaction of respiratory system and cardiopulmonary system. This creates perfusion. It helps keep the cells oxygenated, and it helps get rid of the waste product or carbon dioxide. The lymphatic system is fluid in your body. It helps maintain the balance of fluid, and it captures fluid and puts it back in where it needs to go. Some lymphoid organs would be the adenoids, the tonsils, the spleen, the thymus, and there's also lymphatic nodes. If you should avoid taking blood pressure on the side of a woman's body where there has been a mastectomy, simply because of the lymphatic system and the blood pressure or the water problems that it can create. The nervous system. The nervous system consists of the brain and the spinal cord, and that's the central nervous system, and all of the peripheral nerves that go to the rest of the body, the sensory and motor nerves, are the peripheral nervous system. So our central nervous system is the brain and spinal cord. The peripheral nervous system is sensory and motor nerves. There's also the autonomic nervous system. These are involuntary motor functions that take place. They work automatically. The digestive system provides the mechanisms by which food travels through the body and is digested. This includes the stomach, the small intestine, and the large intestine. There's some accessory organs in the digestive system. You've got the liver and the gallbladder that excretes bile and dumps it into the stomach after you eat. You have the pancreas, which also produces insulin for our endocrine system, and the spleen and the appendix. The integumentary system is the skin. The skin is an organ. What does it do for us? Well, it protects us, and it helps balance our water, and it helps regulate our temperature. It also excretes waste, or it gets rid of waste such as through sweat. Shock absorption. Sometimes if somebody were to touch you, it kind of absorbs that shock so that you're not, they're not touching inside our body, so to say. The integumentary system, the skin, has various layers. We have the epidermis, the dermis, and the subcutaneous layers. 3 layers of skin that somebody would have to get through to cause an infection or to do damage to our muscles and bones. And here's a picture of our skin in the integumentary system. And take a notice of the layers. The epidermis is the top layer, and the dermis is the second layer, and the subcutaneous is the fatty layer. And that's where you see the nerves run through also. The endocrine system produces hormones that regulate many body activities and functions. We have the pancreas. The pancreas makes insulin for our body, which is very important for us to keep the glucose level accurate. Adrenal glands secrete epinephrine. Epinephrine is adrenaline. That's what makes us speed up our heart and speed up our breathing if we get excited. It's called the fight or flight. Endocrine system then has other parts too that regulates hormones. You have the pituitary gland, you have the thymus gland, you have ovaries, you have testes, the pancreas, the adrenal glands, and the pineal gland, and the thyroid also. Our renal system is what takes care of our urine, helps the body regulate fluid levels, it filters out chemicals, and then it adjusts the body's pH. The kidneys are the principal organs of the renal system, but we also have the bladder, so that we're not having to run to the bathroom all the time. We can actually build up a little fluid reservoir before we go to the bathroom. And here's our renal and urinary system, depending on if you're male or female. There's also the ureters that transport the urine to the bladder from the kidneys, and the urethra, which actually helps it to get out. It excretes urine from the bladder to the external environment. Our reproductive system, our female reproductive system, there's ovaries, which is where the egg sacs are, the uterus, where the baby develops, and then the vagina, which is the opening that the baby is born through. And here you've got pictures of that. Refer to your book also to get some better pictures and read the articles. The male reproductive system consists of the testes and the penis. And there's a picture of our male reproductive system, which you would want to look in your books on page 144 and 143. So in review, as an EMT, your knowledge of the anatomy or structure And the functions or physiology of the body will be important in allowing you to assess your patient and communicate your findings with other EMS personnel and hospital staff accurately and efficiently. Major body systems with which you should be familiar are the musculoskeletal, the respiratory, the cardiovascular, the nervous system, the digestive system, the integumentary system, the endocrine system, the renal system, and then reproductive systems, both the male and the female. Cellular metabolism requires a constant supply of oxygen and glucose. So if you don't have oxygen and glucose, then your body's not going to metabolize. We need to metabolize to survive. Cardiopulmonary system combines the functions of respiratory and cardiovascular systems to provide oxygen to every cell. Every cell in our body needs oxygen, glucose, and water. Shock occurs when the cardiopulmonary system fails and cells become hypoperfused. The body is composed primarily of water, and this fluid is distributed throughout the body systems. So when evaluating a patient with a cardiac problem, consider the impact on the respiratory system. When evaluating a patient with a respiratory problem, consider the impact on the cardiovascular system. They work closely together. What impacts do problems in these systems have on each other? If you're having problems breathing, it's going to affect the cardiovascular, the heart's ability to circulate that blood around. It's not getting picked up, and it's not going to get transported to where it goes if it's not there. Shock can be recognized immediately if you're good, and once you get a little experience, it's going to be easier and easier to recognize somebody in shock. And we're going to talk more about the pathophysiology of shock that's coming up in the next couple of chapters, but be prepared in that and review all of your terminology on page 146 and 147. And let's get ready for chapter 7. You're treating a patient who is recently released from the intensive care unit with a massive infection, which we call sepsis. This has impaired the patient's ability to regulate the size of the blood vessels. So sepsis causes the blood vessels to dilate a little bit, which means the blood is no longer filling up the body's blood vessels like it normally would. How might this affect the patient's ability to compensate for any additional illnesses? What steps should you take to help this patient compensate? You need to make sure that they have plenty of oxygen and that their blood is circulating as well as it should be to keep that oxygen and glucose transport optimal to the body.